in his early life, but after a while, his mother, who is now a housewife, realized that he was not keeping up with his growth and development as expected. The 8-year-old was extremely quiet and socially withdrawn and began to exhibit speech impairment. He could not talk.
Nilizaliwa normal person, hakuwa nikiwa pregnant asikuwa na issue yoyote. The time alizaliwa alikuwa normal, the way alikuwa na grow alikuwa normal, but semenye nilirealize akona problem ni akiwa mwaka 1.5. The time namweka na watoto wengine unarealize ako different, anajitenga.
It was at this point that his mother, Anne Wanjiku, realized that his firstborn child was developmentally different from other children his age.
Hiyo ndio time yenye tuliamua kutafuta usaidizi, ndio nilituma hapo family support, ndio akaniambia nimpeleke apimwe masikio. Tuone juu hizo time alikuwa hyper, ile yenye hata ukimuita ana assume. Ndio tukatuma hiyo hospitali opposite Nairobi Hospital, inaitwa Redmark. Tukaenda hapo akapima masikio, masikio ilikuwa normal, ndio tukaanza therapy.
There are many theories and misconceptions surrounding autism. We spoke to a few Kenyans in Nairobi to find out what they knew about the condition.
Hiyo siwezi nikaeleza vizuri inaletwa na nini, maana no, siwezi nikaelewa inaletwanga na nini. Sijui kama I can't talk about the gene ama nini, lakini what I know, wengine uzaliwa nayo na wengine huambukizwa wakati wana grow.
Autism na wakati unasalimia mtoto habari yako, yeye pia anakuambia na habari yako, anarudia the same question. Haya, ukiongea naye anakaa kuzubaa, haelewi kenye unamwambia, na anaweza kuwa pengine na changamoto kwa shule pia. Kimwambia hesabu namba 1 mpaka 10, anaweza kuwa na mtu wa 20 years ama 15 na hawezi elewa. Anahesabu kinguru kama mtoto wa nursery.
Autism ni ugonjwa ambao unapatikana sana wakati mama anajifungua mtoto. Wakati ule mtoto amedelay, akikuwa na labor, iprolongie na huyo mtoto akose kulia. Hiyo kukosa kulia inafanyanga nafsi za mwili zisifanye kazi haraka, na unapata ya kwamba mtoto kama huyo development yake ina delay.
These challenges are a particular pain point for parents with children with special needs. Autism is one of those neurodevelopmental disorders. What is it like to bring up a child who is autistic in such an informal settlement? Because the pandemic not only threatens lives, but also livelihoods.
Mtoto kama huyo kwanza anakuanga kama mzigo kwa mama yake, na pia kwa jamii. Unapata not everyone will understand that child. Unapata hata wazazi wenyewe wanaanza kumneglect, wengine wanamficha, wengine wanaona ni kama ni laana kutoka kwa Mungu. Hata inacausing sometimes families in a break.
According to the World Health Organization, 1 in every 160 children has an autism spectrum disorder. Most parents, especially new mothers, hardly notice the telltale signs until the child is 2 to 4 years old. This was the case with Anne Wanjiku, a mother of 2 who only realized that her firstborn son had autism after she noticed delays in key childhood development milestones.
Ile hali hata mtoto wakati tunamwekea chakula, anakula chakula anarukaruka, mkiendani akitoka nje hizi tulia mahali pamoja. Ukimpea kitu kama kitabu, hawezi tulia, hata akiwa kwa class ako huko ako kule. Yeah.
For the most part, Anne was in denial, failing to accept or recognize that she was raising a special child. Reality only hitting home after Rodney began school and had difficulties catching up with the rest of his peers.
Alikuwa anaenda private school, but tukarealize na akienda shule ni kama hakuna kitu anaelewa. Ndio tukaamua kumtafutia shule ya special. Yeah, for now ameenda 3 years. Kabla nikubali Rodney, lazima nitafute usaidizi, lazima ningekubali kwanza. Na before kubali hiyo kitu lazima upate watu wenye mnaongea na wao. Azini ukitembea unapata mtoto wako anatembea, anaweza vaa, but unapata mtoto ako 10 years, 50, anafungwa diaper. So kitu ya kwanza unashukuru vile yako. Juu kuna mtoto mahali umemweka. Rodney anaweza tembea. So unalani vitu mob juu Ni kitu ngumu but saa hii kwa at least tumekubali.
She took the bold step following recommendations from one of Rodney's teachers in order to get the child assistance by admitting him to a special school. For such parents, raising such a child requires a double effort compared to parents who are raising otherwise normal children. They can hardly strike a balance between working and raising such special children, considering the special attention that is required and needed for the child's growth. This forces them to sacrifice their professional life, as was the case for Anne.
Wasifanye biashara juu ya hii shughuli ya Rodney. Most of the time tunakwanga clinic. Saa zingine tunaenda kama tunafundishwa. So sana sana nakwanga free.
It is more tasking to the parents who are raising these children, and even harder for autistic children who are always on the receiving end during interactions and socialization with their peers.
Kitu kama umpi inakuwa issue, anakugonga. Na kama mtoto mwingine obviously lazima atamgonga.
This has been the case for Rodney, making his parents come up with alternative ways of helping him.
Anapoteanga unamtafuta mpaka jioni. Saa zingine atakutana na majirani huko nje ndio atamleta. So lazima saa zingine unawaelezea wanakuwa friendly, ama una make sure uko karibu in case kitu itokee unaweza kuwaelezea.
This child who has seen it all is now showing good progress, as his mother has kept his activities on track by making sure he brushes his tongue as part of his exercises, keeping him busy with school activities meant to equip him with key life skills and put him on track to meet his own developmental goals.
Naweza enda toilet kama a normal person, kujirisha, naweza jirisha, kujivalisha. Unaweza toka umwache hapa nje na watoto wengine na utampata.
The 26-year-old also watches her child's diet in order to control his sugar levels and behavior, while ensuring he eats only natural foods, which are the most suitable diet for him.
Kuna zile vitu zenye hizi kula azin, kitu kama skari, unga ya ngano, anakula vitu natural. But hizo time alikuwa akiona kitu kama biscuit, na mwenyewe unajua akila kitu kama biscuit sweet anakuwa hyper. But sasa ukimbaia kitu kama melon ako poa, hata akiziona hakuna kulia. So sasa amekuwa poa.
From being left behind while playing with other children to getting lost on his way home, Rodney now is doing well and able to make his way home. In the event that he gets lost, his mother made him a wristband with her phone number, making it easier for anyone to reach her should Rodney seek help.
Ngeneze a chain na nikaeka namba yangu ya simu. In case ukutane naye, unaweza nicall.
She's grateful that she has been able to fight the stigma that comes with people not appreciating such children, as they tend to discriminate against them. And unlike many families who abandon such kids, Anne Wanjiko is grateful for the support of her family.
Kitu ya kwanza kupata assessment ya mtoto wa special inakuanga issue. So huwa natafutwa mahali naweza pata. Kama ni shule nadai, kuna vile wananiambia kuna usaidizi mahali fulani, so huwa tunasaidiana kimawazo.
Her advice to parents with autistic children is for them to accept that the child may have some developmental challenges and start seeking help as early as possible.
Kwanza jikubali tuweze kusaidika na usiseme atulilaniwa. Kitu ya kwanza ukiwa na mtoto a different, yani mtoto ako na disability umebarikiwa juu. Kitu ya kwanza hakuna vile utakuja ukose. Mungu anakuanga naye hata wakati ukiwa mgumu aje.
So my name is Dr. Susan Wamithi. I'm a developmental pediatrician, and what that means is that I help children who have special needs be able to function both socially, academically, and even occupationally for those who are older.
So talking about autism, previously people have thought of it as a Western disease, like something that doesn't affect us here, but we've heard of so many parents whose children have autism or people discussing autism. So what would you say autism is and how does it come about?
So autism, and we call it autism spectrum disorder just because it's very different for each child, But there are core things that we look at, which are called the core symptoms of autism. So this is a child who has difficulty with both social communication and social interaction, and it's in multiple settings, both at home and even in the school settings for those who are school going. And the other thing that accompanies this is a child who has what we call restrictive and repetitive behavior. It's a child who has difficulty with adjusting to new things. Any new changes is very stressful for them, and they like things done in a particular manner without changing their routines. Because there are those who are talented in math, are talented in music, there are those who can hear a song and they play on the piano. So I tell parents, anything that your child is interested in and you see a gift, we harness that gift. There are multiple risk factors, both environmental and genetics. And what we're trying to figure out is what's the genetic vulnerability that can make a family who have almost similar genetics have some children who have autism and others do not. And so there are risk factors like prematurity for some people, things that may have happened, either it's something toxic that the mother ingested. We don't know exactly what the environmental factors are during pregnancy. However, we have to tease it out whether it's genetic or whether it's environmental. But either way, whatever the etiology is, I always say, how do we help this child's functioning? Because parents sometimes can get caught up with what did I do wrong? And I tell mothers, you have nothing to be ashamed about or guilty about, but the fact remains is that how do we help this child's functioning? So those who have genetic disorders, it's important to investigate. Now we categorize bits on a spectrum. We used to have the mild, moderate, and severe, but now we call it level of functioning, because that's what's important, is how are you being able to function in your social communication and social interaction skills, and how you function in terms of your restrictive repetitive behavior. So there's level 1, level 2, and level 3 based on severity. And based on those levels, so those levels we use both for social communication and we use for the restrictive repetitive behavior, so that we can come up with a management plan that's targeting what is bothering the individual at that particular time of their life.
Are there any telltale signs, symptoms, things that parents can pick out from their children as they grow that would point them towards a child possibly having autism?
The easiest way to do is to start from early childhood because people present at different times, and they're usually what I tell parents about are called red flags. So a child who by 1 year of age who is not responding to their name, is having difficulty with even eye contact and engaging with an individual, and delayed speech are usually the earlier signs that most patients will notice and be brought to the hospital. And then after that, when they're in the school-going age, like when they're preschoolers, they're the ones who present with difficulty interacting with their peers because they don't understand social relationships and how to engage with other children. They have difficulty in even in play, where you're seeing that they prefer to be alone. So most parents would like, whenever he's with other children, I see him preferring to be alone all the time. And he has no problems with that. When even other children are engaging them, they try and back off, some will even push away. So in the preschool ages are the ones who still have the delay in their language in terms of communication and still have issues with that social interaction. But importantly is that they have difficulty with transitions. When you think about a school setting, children are moving from one activity to another. So that red flag for a teacher, for example, is that child who has a language delay and it's difficult to move from one activity to another without getting opposition, crying, they have outbursts, and are termed the difficult children, which is a bad term. So children can have, for example, there are those who have will have like motor behaviors where they're flapping around, or echolalia, where you're repeating everything people are saying, or doing things the same way all the time. And a child can play, for example, with one toy the whole time for an hour, and most children move from one thing to another. And if you even try to change that, you find that rigidity and crying and outburst. So repetitive behaviors come in any way or form, and even they change with seasons. So today can be the coins, 3 months from now can be stamps. So it's anything that, because the core symptoms don't change. As children advance in their learning, you're learning something new each term. But for them, they want to remain things being a certain way. So those are the academic difficulties that they have. At the same time, there are social difficulties interacting with other children. Children learn from each other. So if you're not learning because you're not looking at somebody, you're not interacting with someone, you fall behind even in your social functioning. And then another thing is that, of course, it accompanies, there are some children who have like intellectual disability, so even academic achievement is difficult for them. And the one that bothers me is they get bullied by their peers, because by the time you're in middle school or standard 3, standard 4, children are noticing the differences between you and them, and they tend to be bullied. So those are children who can either be withdrawn or have emotional outbursts. For adolescents, unfortunately, that's when a lot of mental health things kick in. They can get anxiety, they can get depression, and school dropout rates just because of the difficulties that come with being both having restrictive ways of doing things and having that social communication difficulties. And for adults, it's if you're not being supported from a younger age, you don't achieve independence. So that's why we really like catching them when they're young, because we want you to be able to socially interact with other people, be able to keep a job, because your job is always changing. If you're rigid in your ways, you won't be able to change when you're given a new project that you're not used to. And then even being in social isolation is a thing that bothers us with adults. Being not even seeking help in terms of their health care because you prefer to be alone, you want to be rigid, you don't want to transition from your home to a healthcare setting. So the adults have a lot of difficulties and in terms of being independent.
How do you make a diagnosis of autism? As in, how do you decide or look at a child, examine a child, take a history and say this is autism and it's not something else, like attention deficit disorder, that it's not something else but it is autism? How do you go about making that diagnosis?
There is the clinical history, meaning what the parent is telling us is going on and their concerns. And so there are specific questions that we ask in terms of communication and social communication, because there are children who can be fluent, but they're not using their language to communicate with somebody else. And then there's that restrictive repetitive behavior, which people don't think about. They have issues with sensory stuff where they're either hyperreactive or hyperreactive to environmental stimuli, and then they have fixed interests. So based on the history, we're able to narrow down as to, is this autism spectrum disorder, or is this ADHD, or is this social communication disorder? There's a standardized testing that we call the Autism Diagnostic Observation Schedule. So that's about an hour where we do what are called presses through play and communication, because that's how children talk to us, and we can test it from both toddlers all the way to adulthood. So we have a set of tests for that, and it's based on the age of the patient and their language abilities. And so through that testing, we're able to tell whether you have autism spectrum disorder and your level of severity.
The big question that parents ask, does this thing have a cure?
Unfortunately, right now, there's no cure, but the children all have the ability to learn and grow. That's what I always tell parents, because that's the thing that's devastating for them, is because you Google it, you see all these different websites that are talking negatively, but every child with the right support can be able to grow and learn. And something that really bothers parents is the language aspect. And I always say communication doesn't have to be verbal language. It can even be a communication device. There are children who write, as long as they're able to communicate what their thoughts are, what their feelings are to their families, and so that families are engaged with their children. It's multidisciplinary, because there are different aspects that we're taking care of. And so the first place we start with autism is something called applied behavioral analysis, and it's called ABA therapy. So ABA therapy is done by behavioral analysts who come up with a program, and the point of it is to increase social behaviors, meaning how are you using language to communicate with someone, and the difficulties that you're having with your repetitive behavior or refusing to play with other children. So that's what ABA therapy is trying to increase good behaviors and reduce the challenging things like aggressiveness, being rigid. That's what ABA therapy does. Then the second place is making sure that if you have any sensory issues, you're seeing an occupational therapist to help with the sensory, whether you're overreacting to stimuli or underreacting to stimuli. That's where the occupational therapist comes in. Then we have a speech language pathologist, a speech therapist, who come up with, are they able to teach you using your mouth to communicate, or do you need a communication device? And any other aspects of behavior, we do that. And for those who have underlying comorbidities like ADHD or epilepsy, we treat with medication.
So there's the child who definitely needs help, needs support, but there's also the parent. And the parent here getting to understand what they're dealing with is a big plus in managing the child. So are there any therapies or anything that is there for the parent so that they're able to cope and know how to raise this child, because this is a child with special needs?
We look at the family, even the siblings. We look at how the siblings are coping with this, how the parents are coping, and even the child who's involved. So we have medical social workers to help with mental support. The parents have organized themselves very well in this country, where they have their own support groups where they get together. It's advocacy, it's education, getting parents who are hiding their children to come out and parent. I call them my parent partners. So my parent partners are really important in getting a mother who is ashamed and there's stigma to come out and bring her child, because those are the things that are proven to have good outcome. Because for me, I tell parents, remember, the child is going to be 18 one day. What do we do with this 2-year-old right now to prepare them for some independence at the age of 18? And that all involves society, because people have to stop their stigmatizing remarks and behavior towards families, as well as the doctors, as well as the parents and the therapists. If a parent is not supported, the child won't be supported.
We've seen parents even going out of the country in search of treatment, medicines, and some of them are stem cell therapy. Stem cell transplant, do this work? Is there a role for all of these different trials or different medicines in managing autism?
Right now, everything is under clinical trials. So I know people are going out of the country looking for treatment, but right now stem cell therapy for neurodevelopmental disorders is under research. So we still don't have evidence for it where someone would prescribe that particular treatment. For me, it's always about advocacy and asking the community to teach people with kindness. We are our neighbors. Africans have been communal our whole lives. So if you're seeing a mother struggling with her child with special needs or has autism, you can give the mother a break by, let me take care of your child for 1 hour so you can go do your hair. You know, those simple things are the things that parents tell me they have difficulty in that getting a break to do something else, having neighbors allow the children to come play with their children. So it's just, let's have practice kindness within the community setting. So, because for me, advocacy is very important, because if the families are not feeling like they belong, then chances are they'll hide their children and these children won't be helped.